The best candidate for a dental implant is a patient that is missing a tooth or multiple teeth, which is in very good health, and it's got a very good bone. Not everybody fits this category, and that's okay. That's why in Costal jaw surgery, we have the technology, the know-how, in order, if there's a deficit on that patient that might need some type of bone grafting, additional surgery, so the patient can have that replacement of that tooth by means of the dental implant. The process to get the patient fitted for implant basically consists of a very thorough clinical and radiographical exam. There's got to be great correlation between the clinical exam, the radiographical exam, which we do with a special machine, which is a cone beam CT. And once we have that determination as to what the patient needs, we have to discuss the treatment plan with the referring dentist or restorative dentist that will be performing the restorative phase or the crown for that implant that will be placed. In some instances, the procedure can be performed in a day. It's on a patient-by-patient basis, okay? Not everybody qualifies for a procedure in a day where you get the implant and the restoration the same day. There's some factors that will contribute as for that, but we at Costal Jaw Surgery do those type of procedures where the implant is placed and the crowns or the restoration can be delivered at that same day. Patients that for some reason either don't have the amount of bone that they need to have some additional bone grafting procedures, then the procedure will be staged where the implants will be placed, let it heal, and then a few months later, the crowns or restoration can be delivered. The recovery time depends as to the type of procedure that you are doing to that patient. What we will call a straightforward procedure, which is basically just the placement of an implant that we tend to do as a single stage. Usually the patient should have at least 1 or 2 days because there's going to be some swelling and some discomfort. When we have to do more extensive or additional bone grafting, the recovery time might change from 3 to 4 for 5 days, but once that period is over, the patient should be fine. It is important to decide and design the smile of the patient before the implants are placed. We need to have a blueprint as to where we're going so that the patient not only has a very good functional but also a very aesthetic result. And by working our way as to what the patient's expectations are, where the teeth should be located within the oral cavity, then we can decide the appropriate surgery that the patient will need to have the future smile that they want. The best way to get information will be to set up an appointment with our front office so we can evaluate you and decide what are your expectations as your needs. Another way to get information about ourselves will be to go to our website, where there's information of each of the doctors as well as to the procedures that we perform and are available in our office.